so here's my theory, and the only thing I can come up with after I'm recording this, because I think it's important. So, we've been fighting an infection for almost 8 months. We've been to countless doctors, at least 15, probably. 2 hospitals, an infectious disease doctor, a couple of primaries, a couple of urgent cares, actually about 5 urgent cares, 2 endodontists, let's see, what else, 2 dentists, made an appointment with another dentist, that got canceled. We've had a CAT scan, a couple CAT scans, PET scan, all kinds of different things. And my son is still suffering from this infection that nobody will diagnose. In fact, at St. Pete General, when I took him there on September 4th, the guy in the emergency room, the doctor's assistant or whatever he was, kind of looked at my son and said, well, this is exactly what he said, I can light you up like a Christmas tree if it'll shake your chain. That's what he said. Took his gloves off, threw them in the wastebasket. Him and Chase both left the room. And I just stood there like, what the hell just happened? So between September 4th and today, he's had another 8 or 10 doctor's appointments at least. We've been back to the hospital. I called Tampa General last weekend, it was about 10 days ago now, and asked them if it would do any good to bring him in. And basically she said, well, if he doesn't look like he's dying, you're probably not going to get a doctor called in the middle of the night. It's basically what it came down to. And since we've been self-pay, you know, I don't want to go waste time or money doing that. So by Friday of that week, we had been to several doctors. Chase's online primary is getting really frustrated and not understanding what's wrong with the doctors in Florida. Basically, he's like, why isn't anybody doing anything for you? And he said the dentists should be leading this because we think it has to do, and it appears that it has to do with bad dental work. That's the only answer we have.
But a lot of times,
at this time,
dental and the medical, they don't see eye to eye.
well, they're not working together,
They
but there's also possibly something else going on. But so
Right.
then the problem is who figures this out, because every doctor we go to or every hospital we go to, they just want to send you somewhere else. So here was Tampa General. We went on Friday after dealing with a primary who's in California on an online meeting, and he's going, what in the hell is going on down there in Florida? What's the problem? He says, I want you to be at Tampa General within an hour. I'm going to call him. I'm going to tell him you're coming. I want a CAT scan from the waist to the top of your head. We already had one of this area that we had done about a week earlier.
Right.
So we go to Tampa General. We wait 2-3 hours. However, it was pretty packed over there, believe it or not. And so we get in there, and they say, oh, well, you're on antibiotics, and you look fine. Why are you here? Well, let's see. Over a month ago, this spread into my brain. It's in my back. It's now hurting my kidney. My shoulder's getting stiff. Well, you're on antibiotics, and you look fine. They say this again. So we're here to get a CAT scan. The doctor called. Well, we don't deal with primary doctors here at the hospital. That's what they tell us. Primary? What's your primary doing? Is it because it's a Friday and because he feels it's a desperate situation? He says there's no time to waste. These are his exact words. And there's no room for error. Well, here we are a week later almost. It's been a full 5 days now. And the oral antibiotics are still failing. We ended up leaving Tampa General with nothing done because they wanted to re-CAT scan his jaw only. And I'm sitting there holding a disc in my hand of the CAT scan from a week earlier of the jaw. The doctor wanted from here to here. I'm not going to pay for another CAT scan of this. I'm paying out of pocket at this point. We're over 10 grand into this and no answer. So we leave. So this was Friday night. So now this is Wednesday. In the midst of all of this, the truck breaks down. $3,000 in repairs. It's like, you know, what else can happen? So we missed an endodontic appointment yesterday, but we had one on Monday where this endodontist said they needed to root canal the top tooth. That's the source of the problem. But the other endodontist said, no, it's the bottom teeth. That's the source of the problem. Both had work done back in February. There's no answers for this, okay, except for what's showing up on the scans. Now it's a deep space or deep state infection. I'm not sure what they call it.
That's deep state infection.
Okay. And so they have to like even adjust the contrast, but they can see it, okay? But we still don't really know where 100% of the source is, or they can't agree on how to treat this. But here's my theory, okay? And it has to do with the opioid crisis.
Right.
These doctors here, and I just had a doctor confirm this, and I says the only explanation that I can come up with
Right.
is that these doctors in Florida have been so destroyed by the opioid crisis and the way that the people in Florida went to them and abused the system and abused them and abused their licenses to get drugs.
Mm-hmm.
That it's...
I've been accused of that.
You've been accused of that. I've been accused of that. I don't take opioids.
I don't take opioids
Okay.
either. Not for 10 years I haven't.
But these doctors are so freaked out about why people are coming to them and what they want that they can't even treat somebody normally. So here we are 8 months into a deep state infection, and we keep getting turned away and invalidated everywhere that we go. He was offered gabapentin, which is still, you know, I think
That's
it's
just treating the symptom and not the cause.
and Chase refused it. He
Right.
refused that. He said, I don't want that. And then he got called a bad patient because he wouldn't take gabapentin.
Because the doctors think that they know best on every single thing. They just want to treat the symptoms so you go away.
Well, that's pretty much it. But yeah, at the same time, this whole yeah.
But
So
also they
the
see-
doctors are always on the defensive. Everybody that comes in, the first thing they're thinking is, okay, they want pills. That's already in their head. And I don't know if it's
Right.
like that everywhere else, but it's like that here in Florida.
Also, if you're self-pay, they want you out of their face. They
Well,
think
that's
that
the other
you
thing.
can't afford it.
It doesn't matter how
Right.
much money you have. Okay, I've put
Right.
out literally 10 grand from February to now out of my pocket. We had
Oh, I know.
insurance until December. He turned 26. That was canceled. Cobra wanted $900 a month, which is about what I've paid out of my pocket over the last 10 months. So, you know, whatever. I just signed him up for United Healthcare, him and my other employee. And that kicks in on November 1st. I don't know if it's going to cover any of this. Nothing's been completely diagnosed, obviously.
Since it's
So
an
I'm at a
ongoing
loss.
situation, they might not.
So here we are with all the money in the world, people backing us up saying, we got the money, we'll take care of everything, and you still can't get a doctor to help you. Okay, so finally this morning, a friend of mine, a CPA actually, who is like been the only person for some reason who's been like family through this whole thing, my CPA, sends me the name of a doctor who I just got off the phone with, and I shared this theory with him, and he said, well, you know, you're exactly right about how doctors are and the way that they treat people. You know, I said, this is my theory, this is what I think, and he said, yeah, you're right. I wonder if the rest of the country is like this. I don't think so. It was so bad here in Florida, the opioid crisis, that our doctors and our healthcare system are completely destroyed. And this is why I think people can't get the help that they need.
That's why I
There's
don't
got
go
to
to the
be.
hospital and I don't go to the doctor.
They turn you away. They don't do anything.
Because-
He literally
yeah.
looked at my son the first time we took him in when my son said, this has moved into my brain. Let's get a handle on this now. He looked at him and he said, well, we can light you up like a Christmas tree if it will shake your chain. That is from St. Pete General here. That's what he said. Pulled his gloves off and threw them in the wastebasket and walked out of the room. We have a problem here. And anyway, so that's my
St. Pete
theory.
General is not a place I would ever take myself or anybody.
Well,
I
I'll never
love.
go back.
Because
Anyway,
they're
we'll
going
let
to
you
mess
know
with
how
my
it
heart.
goes.